Depression is often misunderstood, yet it's one of the most common mental health challenges people face. Did you know there are different types of clinical depression that affect individuals in unique ways? Today, we're diving into these types: clinical, major, mild, and more, to help you better understand how depression manifests and what steps to take if you or someone you love is struggling. Whether you feel moderately depressed or overwhelmed by severe symptoms, this video is for you. Let's start with the common types of depression. These include clinical depression, persistent depressive disorder, atypical depression, and high-functioning depression. Each type affects how you think, feel, and function daily. For instance, someone with major depressive disorder may feel consumed by sadness, while others with atypical depression might still find moments of joy amidst the struggle. Recognizing these differences is the first step to addressing the condition. Understanding why it's important to know your type of depression can be life-changing. Identifying the specific type helps you find the right treatment and support system. It also clarifies why some therapies work for certain individuals but not others. This knowledge empowers you to take control of your mental health journey. Mild and moderate depression can sneak up on you because the symptoms might not feel overwhelming at first. Feeling tired, unmotivated, or having trouble concentrating can seem minor, but when left unaddressed, these symptoms often escalate. That's why early intervention is key, even for mild cases. Then there's persistent depressive disorder, or dysthymia, which is characterized by a low mood lasting 2 years or more. It's not as intense as major depression, but it can drain your energy and joy over time. People with this type of depression often describe feeling like they're simply existing without truly living. You might have heard of high-functioning depression. It's not a clinical diagnosis, but a term for people who outwardly seem fine while battling depression internally. They may excel at work or maintain relationships, but still feel empty or exhausted. This can make it harder for them to seek help because their struggles are less visible. Clinical depression, or major depressive disorder, is one of the most well-known forms. It's marked by severe symptoms like prolonged sadness, loss of interest in activities, and even physical changes like appetite or sleep disturbances. If you've been feeling this way for at least 2 weeks, it's essential to reach out for help. Atypical depression is different in that it often includes temporary mood improvements in response to positive events. However, it also brings challenges like excessive sleeping, increased appetite, or feeling weighed down physically. Recognizing these symptoms can help pinpoint the right treatment. Another serious form is psychotic depression, which involves symptoms like hallucinations or delusional thinking alongside depression. This type requires immediate medical attention, as it can be dangerous if left untreated. Then, there's treatment-resistant depression, where traditional medications and therapies fail to provide relief. If this sounds familiar, don't lose hope. New treatments like transcranial magnetic stimulation or ketamine therapy are offering breakthroughs for many. Beyond these, there are other types of depression, like seasonal affective disorder or postpartum depression, each with unique causes and symptoms. Knowing which one you're dealing with can help you find tailored solutions. You might wonder, what type of depression do I have? This question is critical to finding effective treatment. Self-awareness and seeking professional guidance can make all the difference in understanding your mental health. But what about the root causes? Depression can stem from biological, psychological, or social factors. Sometimes it's a mix of genetics, brain chemistry, or life events like trauma or loss. Identifying what's causing your depression can guide the treatment process. If the cause isn't clear, don't panic. Other causes of depression might include chronic stress, medical conditions, or even side effects from medications. A thorough evaluation by a mental health professional can help uncover the underlying issue. Understanding the types of clinical depression is the foundation for taking charge of your mental health. Whether you feel mildly or moderately depressed, knowing the specific type of depression you're dealing with can lead to the most effective treatments. Remember, recovery is possible, and you deserve to feel better.